Look at this. Alan. Pay no attention to that over there. We're cleaning up. But look at him. Alan. You're a silly boy. You're a silly boy. You're silly. Are you stuck? Do you need help? Okay, I'll come help you. Hi everyone, I'm Dawn. Welcome to my channel. Thank you for visiting with me today. I had to start this video over because Alan is, I recorded like maybe 5 minutes of it. Alan is going so nuts in here. He got behind me, he started climbing up my background. He is energized right now, but it's adorable. So I'm just gonna try and ignore him and get through this. So this is a weight loss journey video, and we are going to discuss my panneculectomy experience. For those of you who may be curious or are interested in getting one yourself, now it is the excessive skin removal after, usually after big weight loss, like you'll have excess skin after a huge weight loss. I lost 260 pounds, and I did not like the hanging skin, so I decided I needed to get that dealt with. And I was concerned that insurance wouldn't cover it, but it ended up not being a big issue for me. But anyway, it's called a panneculectomy, and it's an operative procedure used for removing excess skin from the abdomen. It's performed on patients with a large overhanging panniculus, or it's also called an apron. And a panneculectomy is considered medically necessary when there is documentation of significant impairment, a functional impairment like cellulitis, abscesses, blistering, skin ulcerations, rashes, and or there has been documented significant weight loss. And insurance may cover the surgery if it's considered medically necessary because the excess skin is causing issues such as the ones I listed, also back pain, chafing, dermatitis, infection, or other functional impairments. So anything that affects your daily functioning in life, it can include movement. Like maybe you have to be able to move a certain way and you just can't do it with that hanging skin. And now this is different than a tummy tuck or an abdominoplasty. A tummy tuck is tightening of the abdominal muscles, sculpting and contouring, and can involve liposuction. Although a panneculectomy can sometimes involve liposuction, like mine did. I did get some liposuction with mine. It was just part of the procedure, so it was still covered by insurance. Now you can get a tummy tuck along with your panneculectomy, but that portion of the surgery would almost never be covered by insurance. Say hi to Alan. Okay. He's climbing all over me now. So there is no set weight that you have to be to get a panneculectomy, but ideally your BMI should be 30 or lower, or if you are at or near your weight loss goal, but your BMI should still be 30 or lower. And it's important to lose as much weight as possible before the surgery, before the procedure. So even if you've scheduled the surgery like a couple months down the road, still continue to try and lose more weight, because the more weight you lose, the more skin they can remove. Generally speaking, a good candidate for a panneculectomy is physically healthy and at a stable weight. Like the weight has been stable for several months. A non-smoker, like no weight gain. There could be more weight loss, but no weight gain. A non-smoker, and you have recurring skin issues underneath the apron, or significant pains related to that, like back pain and such. Mine caused hip pain back here, and I already have bad hips from falls and accidents and stuff. Way back in the day, I used to skateboard and do a little surfing, and I always got my butt kicked. I don't know what I was thinking. I was young. That's what I was thinking. Now you can drop 1 to 3 sizes generally after a panniculectomy once all the swelling goes down. But for some that maybe more or less. I went down 4 sizes after my panniculectomy. Yeah. The cost of surgery can range from $8,000 to $16,000, more or less. So if your insurance won't cover it, shop around, because you may be able to find a reputable surgeon who will do it for less. Now, I was lucky because my insurance covered it, and I also already met my annual out-of-pocket, so I didn't have to pay anything at all for the surgery. I didn't pay anything for it. And as with any surgical procedure, there are risks and possible complications. Anesthesia risks, like bad reaction to the medication and breathing problems, trouble waking up from it, which I learned can make you more susceptible to getting pneumonia after the surgery. A fluid buildup under the skin, but they do give you drains. I don't know if they still do that, but when I had it, I had 2 drains. The skin not healing properly, scarring, prolonged swelling, nerve damage, discoloration, and infection. So it's really important to follow all the instructions that the doctor and the nurses give you, and follow them to a T, because they're not just giving you these instructions to be a pain in your butt. It's to help you. Like, one thing for sure is they give you a compression garment, and you have to wrap it as tight as you can around you and keep it on 24/7 for, I believe it was 3 weeks for me. And you get one after your surgery, but I would recommend also going on Amazon and getting another one, because they get stinky, so you're going to want to wash it by hand. I'm sorry, this kitten is really distracting me. But yeah, you're going to want to wash it by hand. So you're going to want another compression garment, 1 or 2 more. They're not very expensive. They're nowhere near as much as the hospital charges you. And they're basically the same ones. You can get them on Amazon. It's the same ones the doctor gives you. And so let me tell you a little bit about my experience. I know I peppered in some information with my notes, but so I had mine, I want to say 2019, 2020. No, that was my breast reduction. I had the panniculectomy I had in 2017, I believe it was. And I went to the surgeon and I asked them, well, I called them first. I asked them if they thought insurance would cover it. And I said their name was given to me by my weight loss surgeon. And they said insurance will frequently cover a panniculectomy. So they had me come in for a consult. The doctor was really nice, very thorough. And he told me what to expect, taught me, explained to me that I have to have realistic expectations. And he said that the surgery takes about 45 minutes to an hour normally, and that barring no anesthesia complications, he thought I would come out of it fine. And I think that they just went with my most recent blood work I had, and they got me scheduled pretty quickly. Like, I want to say I had the consult that day and was scheduled for surgery like maybe a month later. I don't remember exactly. It was 2017. That was a while ago. But so I went into the hospital for the surgery really early in the morning. Eric came with me. Oh, and this doctor, he also introduced himself by first name. He didn't say, I'm Dr. Lubadubadubba. He just introduced himself by his first name. And he was very, not a hippie doctor, but he was very cool. And he was also anti-narcotic drugs. So he only prescribed gabapentin for pain, gabapentin and Tylenol and ibuprofen interchangeably, like rotate it, you know. So, and it worked for me. I didn't have any pain. I was fine with the gabapentin. And it was, so, and surgery is, anesthesia is always funny to me, because it's like, 1 second you're awake and you're in the room with your husband, and the next second you're awake and there's a nurse there telling you the procedure is done. And it's like, that block of time is just gone. It's weird. But, and it was the same thing. I was like brought in to be put to sleep, and then I was awake. But I wasn't in a lot of pain when I first woke up, and he did recommend getting up and walking around a lot. You don't want to lay around with a big wound like that. You want to keep that blood circulating and everything. And I did walk a lot, and they taught me, you know, how to put the compression thing on, which is pretty self-explanatory. It's just you stretch it around you, and the Velcro adheres. And so they gave me my instructions and my paperwork and sent me home with my prescriptions, and it was as easy as that. It was effortless, really. It was effortless. But then the hard part started, because they also taught me about the drains. I had 2 drains. I had a drain on each side. I have a scar from hip to hip, like on the side here. So yeah, I have a scar from hip to hip. Well, it started on the side. Now that I've lost more weight, they're closer to the front. But it's the incision goes all the way across, because they cut all that off, give you a new belly button. So I have a brand new belly button, which part of me is like, but that's my belly button that I've always had, and now I have a new one. But yeah, they give you a new belly button. So I have a scar all the way around my belly button, because they gave me a new one, of course. I mean, it's the same belly button. They just reposition it. So, and they said they removed a good bit of skin. I don't remember what the weight was, but I was 17 pounds lighter after the surgery and after all the swelling went down. So I guess that's how much they removed. And where was I? Oh, the drain. So there was a drain coming out of each side, each incision, this left and right. And they had to stay compressed. And as they would fill up, I had to record how much fluid was in the right one and the left one. And I would have to, you know, empty the drains and, you know, keep an eye on how much fluid I was putting out, you know, and would need to call them if it was a terrible lot of, like if it was a whole lot of fluid. My follow-up visit was just a couple days later. Everything was fine. They left the drains in, and a couple days after that, I went back, or was it maybe a week after that, I went back and they took the drains out. And it was weird. It feels so weird for the drain to be pulled out. It doesn't hurt. It's just bizarre feeling. It's just like, it's not pleasant, but it doesn't hurt, if that makes sense to you. It just, I mean, if you've ever had a tube in you and had it pulled out, then that's kind of how it feels, like having a tube in you and having it pulled out of any orifice, pretty much. But because they were draining, like they weren't draining that much after my 2-week visit, they went ahead and pulled them. And then after about maybe 6 to 8 weeks after the surgery, all the swelling had gone down. I was able to take the compression garment off and see what I looked like. And it was different. It was weird. It's still weird to look at me and see me without that hanging skin. Because before I had the weight loss, it was just this big, huge, ugly belly. And then after the weight loss, it was this hanging skin. So yeah, and that was all gone. And was it worth it? Yes, it absolutely was worth it. You gotta be real super careful not to gain weight again, and because then you might have to get the procedure again unless you just gave up and don't care anymore. And let me think, what else do I want to tell you? I told you about the new belly button. I told you about the compression garment. I told you about the drains. Yeah, that's about it. It really was just an easy experience for me. I didn't have any health issues. I didn't get pneumonia, which is surprising because when I have a surgery, I usually get pneumonia about 2 weeks later. It never fails. I didn't this time though. So that was good. Oh no, I did. That's right, I did get pneumonia. I got it while I was healing. And then I recovered, and then after I got better. That's right. I was thinking of my breast reduction. I didn't get pneumonia. But yeah, I did. I got pneumonia twice after that surgery, like within a couple months of each other, and was in the hospital both those times. That's right. I forgot about that. So, you know, you want to do the breathing exercises. That's the other thing. They want you to do, the anesthesiologist wants you to do breathing exercises, and they'll send you home with the breathing tool if they feel you need it. I don't think everybody gets that, but yeah, I didn't do my breathing exercises as regularly as I should have. And I'm increased risk because of the asthma, but but yeah, I think that's really all. It was a really easy procedure. It is worth it in my book if it's something you're interested in. You don't have to be a weight loss surgery patient to get one. And if you're at your ideal weight, but you still have a hanging belly, and you didn't go through a tremendous weight loss thing or anything, and you want to have one done, still talk to, you know, go in for a consult, because they may still be able to get insurance to cover it for you. And again, you can get an abdominoplasty and panneculectomy together, but the abdominoplasty will likely not be covered by insurance. And yeah, I think that's really it. I just wanted to share with you my experience. So obviously it was a pretty positive experience for me, except for the pneumonia that I forgot about until just now. But don't let that scare you, because I don't think that that's super common. And you just gotta do the breathing exercises. If they don't give you the device, they might teach you breathing exercises. Just do them. I forgot what the little device is called. But yeah, just if someone who has had a lot of weight loss, has a hanging belly, you know, has an apron or a pannus that they don't like, and they're at their ideal weight, or their weight loss has stalled, but they're pretty close to their weight goal, I would say go get a consult, you know, if you're interested, because it is so worth it, in my opinion. Clothes fit me better. I still can't believe it when I go to a dressing room and I try something on and I don't have to pull it up over a big gross belly. What do you want? What is the problem? Oh, I love you so much, Alan. I'm sorry, Alan was in here making all kinds of noise. I hope that y'all didn't hear that. He wasn't making you crazy, but he is. Say hi. But anyway, that's it. I guess kittens interfering with my videos is going to be a thing now. Thank you so much for watching, and I'll talk to everyone later. Bye.